Hello again, everyone. My name is Marty Guthmiller, and I am CEO at Orange City Area Health System, bringing you today, March 29th, 2021, our 98th edition of the COVID-19 Community Briefing. Today's going to be relatively short. I don't have a lot of information to share today, but there might be more coming later in the week, and I'll talk about that in a little bit. So first of all, our statistics. I'll jump right into the local scoreboard. In total now, we have 1,933 positives out of the 10,281 tested. Again, more importantly, for the week, we've had 145 tests, and with 22 of those being positive. So our positivity for the week here at Orange City Area Health System has been 15.2%. Moving to Sioux County then. And all these numbers now are slight upticks from where we were. Again, nothing dramatic or nothing statistically relevant, but nonetheless, a little bit of an uptick. 14-day average for Sioux County is 6.1%. That is exactly the same as a week ago at 6.1, and up a little bit from 2 weeks ago at 4.5. Our 7-day average is 6.2. And this is one of the numbers that is down a little bit from last week is 7.3, but then up from 2 weeks ago at 5.3. So 7-day average 6.2, up from a week ago or down from a week ago, sorry, at 7.3. Region 3, the number of hospitalizations in the 20 counties in Northwest Iowa is a little bit up at 38. 10 up from a week ago when it was 28, and then 2 weeks ago at 29. We have 4 people in the ICU, which is the same as a week ago, and we have 1 person on the ventilator, which is the same as a week ago. Moving higher up in terms of the entire state of Iowa, a little bit of an uptick. 14-day average is 4.5%, up from 4.0. and then 3.9 2 weeks ago. Our 7-day average, 4.9%, up from 4.2 a week ago and 3.8 2 weeks ago. So again, a little bit of an uptick. And you can compare the Sioux County 7-day average at 6.2% to the Iowa average 7-day at 4.9%. In terms of Iowans being hospitalized with COVID somewhere, that number has gone up 192, up from 174 a week ago, which was up from 160 2 weeks ago. In terms of Sioux County, we have 3 Sioux County residents hospitalized somewhere with COVID. And that was 1 a week ago and 1 2 weeks ago. We have had 50 additional deaths in the state of Iowa at 5,725. Again, whether they're COVID related or COVID direct, I am not sure, but 50 more COVID related deaths at minimum in Iowa. Sioux County remains at 69, which really has not changed in, I believe, 4 or 5 weeks at this point. So those are the statistics for today. I'm going to move in now to some local information and more importantly, probably the vaccination status of where we're at with things. Just an overall picture, we have given over 4,300 vaccinations here at Orange City, and that is both prime and booster doses. In terms of what's ahead of us, we are still under the notion or the impression that our Moderna supply is going to stay at 170 a week. That hasn't changed for several weeks. We are not anticipating that changing moving ahead. We are supposed to find out tomorrow, Tuesday, what the Johnson & Johnson vaccine distribution or allotment is going to be like. We are anticipating some kind of definition to what the state is saying widely available on April 5th to be in part solved by or as defined by the Johnson & Johnson vaccine. Don't know that, but tomorrow we'll find that out. If anything substantial, I will do another briefing, because the first thing we need to do is find out, are we going to get additional doses? Then secondly, what kind of dose? And thirdly, are there any strings attached in terms of who those doses apply towards? Generally speaking, also, we are seeing a little bit of a increased allotment relative to the retail providers, the Hy-Vees of the world, the Walmarts of the world. Again, Hy-Vee and Sioux Center has been receiving some federal distribution, and that's a key thing. That's a federal allotment or a federal distribution that comes with different requirements than the state. And quite frankly, the state requirements are a little more stringent right now. Hy-Vee is a little freer to give that vaccine to others that we may not be with our state allotments at this point. So stay tuned for that. Please check with Hy-Vee. Also, I believe you can go to their website and find that out. But we're hearing perhaps some of the widely available comments by the state might be applying towards the retail side of the equation, maybe more than the hospital side. So I guess we'll know more tomorrow. Relative to names being on the list, we're encouraging everybody now, regardless of your situation, to call in and get your name on our list. That is everybody at this point 18 years and older. We are still prioritizing right now with the 64 and under with comorbidities. Again, the definition of comorbidities or a comorbid condition is pretty broad, and that includes a BMI of 25 or higher. So pretty broad comorbidities are allowed in terms of the current prioritization. But again, we really encourage everybody to get on our list, because as these allotments change, or as we have some extra doses here and there, we want to be able to call those people on the list and make sure that they have the opportunity to come in as soon as possible. Regarding our waiting list, we currently have 202 on that wait list, which basically speaking would be taken care of with next week's allotment. And so we're maybe a week to maybe 2 weeks out there with our list right now. So again, another reason to encourage everybody at this point to go and get on our list, and then we'll sort through eligibility once we have you on the list. So just another encouragement to please get on the list. We encourage everybody to be vaccinated. We need to reach herd immunity. We need to reach it. The sooner we reach it, the better. And so we really encourage you to get your vaccine and get going, get on that path. We look forward to a great summer, be able to spend time with friends and family, and get back to discovering what the new normal might be. So that's going to be it for today. I want to encourage you and thank you for all of your vigilance so far. We're not out of this yet. We're not done with it yet. But we're starting to emerge from the tunnel. There's just no question about that. So thank you again. We wish you good health. Please stay strong, stay vigilant, and of course, stay healthy. Thank you again for joining us.